Before we go further, subscribe to this channel because today's message may explain why your blood pressure monitor has been deceiving you. If you are between 70 and 85 or you love someone who is, this is one of those videos you cannot afford to ignore, not even for a day. Because a wrong blood pressure number is not just a wrong number. It can scare you into panic, push you toward medication changes you never needed, or worse, make you feel safe when your body is quietly moving toward a stroke, heart failure, or a dangerous fall. And the truly unsettling part is this. Many seniors think they are checking their blood pressure carefully at home, when in reality they are repeating the same hidden mistakes over and over again. I'm Dr. Thomas Richard, and after decades of caring for older adults with heart disease, I can tell you this with complete honesty. Some of the most misleading blood pressure readings I've ever seen did not come from broken monitors. They came from good people using decent monitors the wrong way, usually in ways nobody ever properly explained to them. A number flashes on the screen. It looks scientific, it feels official, and that makes it very easy to trust. But the body is sensitive. Blood pressure changes with posture, tension, bladder fullness, movement, clothing, timing, cuff fit, and even what you did 30 minutes earlier. So in this video, I'm going to walk you through the most common mistakes I see seniors make when measuring blood pressure at home. And please stay with me all the way to the end, because mistake number one is the one that can quietly distort every reading you take day after day, year after year, even if you think you're doing everything else right. And once you understand that one, you'll never look at your home monitor the same way again. Let's start with mistake number 10, because this one seems harmless. It feels innocent. In fact, many people believe it shows discipline, but it can throw off your reading before you even sit down. Mistake number 10 is measuring your blood pressure immediately after moving around, even if that movement feels light. I'm talking about walking to the kitchen, climbing a few stairs, bringing in the mail, feeding the dog, making the bed, or hurrying to answer the phone. None of that feels like exercise, especially if you've done it for years. But your cardiovascular system does not care whether the activity felt dramatic. It only responds to what your body just did. Let me tell you about Helen, 79, from Ohio. Every morning she woke up, put on her slippers, walked to the porch, picked up the newspaper, let the cat in, and then sat down to check her blood pressure. She thought she was doing a wonderful job being consistent. Same chair, same time, same machine. But the numbers were climbing. One morning it was 162 over 94. The next day it was 168 over 96. By the end of the week, she was convinced something terrible was happening. What she didn't realize, was that those few minutes of walking and light lifting were enough to raise her heart rate and trigger a temporary elevation. She was not measuring resting blood pressure. She was measuring moving around the house blood pressure. That distinction matters more than most people realize. Home blood pressure monitoring is meant to capture your resting state, the number your doctor can actually use to judge how well your treatment is working. If you measure right after movement, your reading may reflect activity, not your true baseline. That can lead to unnecessary fear, unnecessary medication changes, and unnecessary side effects like dizziness or weakness. So here is the rule. Sit quietly for at least 5 full minutes before you measure. No chores, no walking, no stairs, no rushing. Just sit. Let your body settle. That 5-minute pause is not optional. It is the bridge between noise and useful information. Now, mistake number 9 is something people laugh off all the time until they understand what it can do. Mistake number 9 is measuring with a full bladder. I know that sounds almost silly, almost too simple to matter. But a full bladder can push your blood pressure higher than it really is, sometimes by a surprisingly large amount. And if you're in your 70s or 80s, there's a good chance this happens in the exact part of the day when you're most likely to measure, first thing in the morning. Walter, 82, from Arizona, had a routine he followed with military precision. He woke up, sat on the edge of the bed, wrapped the cuff around his arm, and checked his pressure before he did anything else. He thought that made him more accurate. But his morning readings were always much higher than the ones taken later in the day at his doctor's office. He kept telling everyone, "My pressure is always worst when I wake up." Well, yes, there is a normal morning rise in blood pressure, but that was not the whole story. Walter was also measuring with a bladder so full it was stressing his body. Once he used the bathroom first, then sat quietly, his numbers dropped into a completely different range. This matters because many seniors are told to stay hydrated, and that is generally good advice. But hydration can also mean you wake up needing the restroom, and if you check your pressure before you go, you may be capturing a false elevation. A full bladder creates internal stress, your nervous system reacts, your body is less relaxed, the reading climbs. So before you measure, especially in the morning, empty your bladder first, then sit down, rest, and take the reading properly. It is one of the easiest corrections you can make, and one of the most overlooked. Mistake number 8 is measuring too soon after coffee, tea, smoking, eating, or exercise. This is another one that catches people because the habit feels normal. Someone wakes up, makes coffee, takes a few sips, and then checks their pressure. Or they finish breakfast and decide while they are already sitting to do it then. Or they come back from a walk and think, perfect, I'm already paying attention to my health. But blood pressure is not that forgiving, and timing matters. Marjorie, 76, from Florida, called her daughter in tears because her blood pressure was suddenly out of control. Her home readings had jumped by 15 to 20 points over a month. New medication seemed inevitable. When we went through her routine carefully, one small change stood out. She had started enjoying a stronger dark roast coffee in the mornings and was measuring right after breakfast. That one detail, something she barely thought worth mentioning, was enough to muddy the picture. Caffeine, meals, nicotine, and recent exercise can all affect your reading. They do not mean your monitor is lying. They mean the conditions are not standardized. If you want a reading that truly helps you, you have to create a clean testing window. Avoid caffeine, smoking, and exercise for at least 30 minutes beforehand. Try not to measure right after eating a meal. And if you did any of those things, don't guess whether they mattered. Assume they did, and wait. This is how seniors get trapped into believing their pressure is randomly swinging all over the place, when often it is their routine introducing the variation. The more stable your preparation, the more meaningful your numbers become. Mistake number 7 is talking, watching stressful television, or using the phone while the cuff is inflating. People underestimate this one because it feels too small to count. But blood pressure measurement is not like stepping on a scale. It is not just capturing body weight in silence. It is trying to interpret delicate pressure changes in your artery while your body is either calm or not calm. And the moment you talk, react, laugh, complain, answer a question, or watch something upsetting on the news, your body changes. I remember a patient named Gloria, 73, from Georgia. Her daughter had bought her a beautiful new monitor, and every evening Gloria would check her pressure while talking on speakerphone to her sister. Same hour, same conversation ritual, same chart on the refrigerator. Her evening numbers were always awful, 15 to 20 points higher than her morning readings. She thought nights were becoming dangerous for her, but what was really happening? She was measuring during conversation, emotion, memory, reaction. A little laughter, a little worry, a little irritation about the headlines. It all mattered, even when she thought she felt calm. When you talk, your breathing changes, muscles in your chest and throat engage, your nervous system becomes more active. If the television is on, especially the news, your attention is divided and your stress level may quietly rise. Even if the effect seems small, it is enough to distort the reading. So when the cuff goes on, think of it as a tiny medical procedure. No talking, no phone, no television, no multitasking. Sit still, be silent, and let the monitor do its job. Because if your body is busy reacting, the number on the screen may not represent your true resting pressure at all. Mistake number 6 is bad sitting posture, and this is one seniors make all the time without realizing it. Maybe the kitchen chair is hard, so you lean forward. Maybe the couch is soft, so you sink and twist. Maybe your feet don't quite reach the floor, or maybe you cross your legs out of habit because it feels more comfortable. But the position of your back, hips, knees, and feet affects the reading, and that means comfort alone is not enough. Correct positioning matters. Edna, 80, from Missouri, had numbers that bounced in a way that made no sense. At home, she was usually high. In the clinic, she was sometimes normal, sometimes not. She brought her monitor in and showed us exactly what she did. She sat on a low recliner, crossed one leg over the other, leaned slightly sideways, and let the cuffed arm angle across her body. She had no idea any of that mattered. Why would she? No one had ever explained that a supported back, uncrossed legs, and both feet flat on the floor are part of the test itself, not just suggestions for comfort. Here's the position you want. Sit upright in a chair with your back supported, put both feet flat on the floor, keep your legs uncrossed. Don't perch on the edge of the seat, don't slouch, Don't measure on a bed unless you truly have no other option and can recreate proper support. The more stable and symmetrical your posture, the less extra strain your body has to manage. That is what lets the reading reflect your blood pressure, not your awkward position. It sounds simple, but this one change can clean up a lot of bad data. Mistake number 5 is letting the arm hang low, holding it up in the air, or failing to support it properly. This one is huge because now we are dealing with gravity, and gravity is not an opinion. If the cuffed arm is too low, your reading may be falsely high. If the arm is held too high, it may read falsely low. And if you are using your muscles to hold the arm in place, that tension alone can affect the result, especially in older adults with shoulder stiffness or arthritis. Samuel, 78, from North Carolina, used to check his blood pressure at the kitchen table, but he didn't like resting his arm because he said it made the cuff feel bulky. So he would lift the arm slightly and hold it there while the machine ran. The result? Numbers that looked higher and higher each week. He thought he was getting sicker. In reality, his shoulder muscles were working, his posture was off, and the cuff was not sitting at heart level. Once we supported his arm on the table with a folded towel under the elbow and adjusted the height, the numbers changed immediately. The arm should rest on a firm surface. The middle of the cuff should be about level with your heart. If you need a pillow, towel, or cushion to get the height right, use it. Do not let the arm dangle off the side of the chair. Do not hold it up. Do not rest it in your lap if that places it too low. This is one of those details that seems technical until you realize it can turn a perfectly good monitor into a machine that repeatedly misleads you, and then it stops feeling technical very quickly. Mistake number 4 is measuring over clothing, especially over a sleeve, a sweater, or a shirt that has been bunched tightly above the cuff. Seniors do this more often than younger people because mornings are cold, layers are comfortable, and no one wants to keep undressing and redressing just to take a reading. I understand that, truly. But the cuff needs to sit on bare skin, not thin fabric, not just a little sleeve, bare skin. Dorothy, 84, from Pennsylvania, used to check her pressure in a long-sleeved house dress every morning during winter. Some days she slid the cuff under the sleeve. Other days she rolled the sleeve up tightly above her upper arm and wrapped the cuff below it. Her readings were consistently higher than expected, and everyone assumed her blood pressure was worsening with age. But the monitor was being asked to read through interference and compression. That rolled fabric was acting like a constricting band above the cuff, and the clothing itself was affecting the quality of the measurement. Please hear me on this point. Convenience is not worth corrupted data. Remove the clothing from the arm completely. Don't roll a tight sleeve up if it leaves a band around the upper arm. Change into something easy if needed. Keep a loose top nearby if that helps. The cuff should sit snugly on bare skin with no fabric underneath and no tight sleeve pressing above it. That one correction alone can prevent weeks, months, or years of confusion, especially in colder seasons when layered clothing becomes part of the routine. Now, mistake number 3 is one that frustrates doctors and confuses families more than almost any other. It is measuring at random times and then treating all the numbers like they belong in the same story. They don't. Blood pressure changes through the day. It rises and falls with your natural rhythm, with medication timing, meals, stress, activity, and sleep. If one day you measure at 6:30 in the morning, and the next day you measure at noon, and the next day after dinner, and the next day just before bed, you are collecting snapshots from different worlds. Leonard, 75, from Nevada, was convinced his medicine had stopped working. Why? Because his log was chaos. Tuesday at 7 a.m., 128 over 76. Wednesday at 2 p.m., 149 over 88. Thursday at 9 p.m., 136 over 80. Friday after grocery shopping, 158 over 90. He saw rising danger everywhere. But when we standardized the timing, the pattern calmed down. Morning before breakfast and before medication. Evening before dinner. Same chair, same process, same quiet rest beforehand. Suddenly the noise disappeared, and the true pattern became visible. If you're going to monitor blood pressure at home, consistency is everything. Pick the times your doctor recommends and stick with them. For many seniors, that means morning and evening, taken under the same conditions each day. This does not mean you can never take an extra reading if you feel unwell. Of course you can. But your routine readings, the ones meant to guide treatment decisions, should be as consistent as possible. Otherwise, you are not comparing and the monitor becomes a source of confusion rather than clarity. Mistake number 2 is taking one reading, reacting to it emotionally, and treating that single number like a verdict. This causes so much unnecessary fear. One reading is only one moment. Blood pressure naturally fluctuates, and the first reading is often a little higher because the body is still settling. That is why a single number taken once in a tense moment tells far less than people think, especially if you are already worried about what the screen is going to show. Rose, 77, from Louisiana, had a habit that nearly drove her into a breakdown. She would take one reading in the morning. If it looked high, she would panic. Then she would immediately retest while scared, watch it climb again, and spiral into a miserable day. Sometimes she called her son before 8 a.m., convinced she was having an emergency. What finally helped her was a simple protocol. Sit quietly, take the first reading, wait 1 minute, take a second, wait again if needed, and look for the average pattern over time rather than worshiping a single number, especially the first one. This is so important. If your reading is higher than expected, don't assume disaster. Sit quietly and repeat it properly after a minute. Many people need 2 readings, sometimes 3, to get a realistic picture. And never make medication changes on your own because of one alarming number unless your doctor has specifically told you exactly how to respond. If you ever get a reading over 180 over 120 and you also have symptoms like chest pain, severe shortness of breath, weakness, vision changes, or trouble speaking, that is different. That is emergency territory. But most of the time, one isolated high reading needs calm repetition, not panic. And now we come to mistake number 1, the most dangerous one in this entire discussion, because it can sabotage every reading you take from the very beginning. Mistake number 1 is using the wrong cuff size or using a monitor that does not truly fit your arm and has never been properly validated for accuracy. This is where people lose years of reliable information without realizing it. They think, I bought a monitor, so I'm covered. But no, not necessarily. A monitor is only as trustworthy as its fit and its accuracy. Let me tell you about Irene, 81, from Michigan. She was small-framed, narrow upper arms, very careful, very organized. Her home readings were almost always high, even though she felt weak and lightheaded on the medication she had already been prescribed. Her family thought her pressure must be severe. Her doctor kept trying to make sense of the numbers. Finally, someone measured her arm properly. The cuff she had been using was too large for her, much too large. The machine had been giving readings that did not match the reality inside her body. And those false numbers had shaped treatment decisions for months. Now let me tell you about Carl, 83, from Texas. Carl had the opposite problem. He had a larger upper arm, but he was using a cuff that barely fit because it came with the machine, and he assumed one size must be standard. His readings were all over the place and often higher than expected. He blamed age, he blamed salt, he blamed stress, but the cuff itself was wrong. When the cuff size is off, the measurement can be off. And once that happens, every beautifully logged number in your notebook may still be misleading because the error is built into the process from the very start. This is why cuff size is not a minor technical detail. It is a foundation. You need a cuff that matches the circumference of your upper arm. Not close enough. Not the one that came in the box, so it must be fine. The right size. And beyond that, use an automatic upper arm monitor from a brand or model that has been clinically validated for accuracy. Not every monitor sold online deserves your trust. Some are convenient, some are flashy, some are cheap, and some are simply not good enough. A bad device or wrong cuff can make you believe things about your health that are not true. So how do you protect yourself? First, measure around the midpoint of your upper arm and compare it with the cuff range listed for your monitor. If you are not sure, ask your pharmacist or doctor to help you. Second, bring your monitor to a medical appointment and compare it with office readings. Let someone verify that you are using it correctly and that the machine behaves as it should. Third, be cautious with wrist and finger monitors. Many people love them because they look easy, but upper arm monitors are generally more reliable, especially when accuracy matters most. And I want to pause here because this is the moment many seniors realize something painful. They realize they have been trying, really trying. They were not lazy. They were not careless. They bought the machine. They wrote down numbers. They worried. They did what they thought responsible adults were supposed to do. And still, the readings may have been off because nobody gave them the full picture. If that is you, please don't feel embarrassed, and don't blame yourself. Most of these mistakes are common precisely because they seem so reasonable. But now you know better, and that changes everything. Now you understand that home blood pressure monitoring is not just pressing a button. It is creating the right conditions, so the number on that screen actually means something. It is using the bathroom first, avoiding caffeine and smoking beforehand, sitting with your back supported and your feet flat, resting quietly for 5 minutes, keeping the arms supported at heart level, using bare skin, staying silent, taking more than one reading, measuring at consistent times, using the right cuff on a validated upper arm monitor, not just whatever happened to be easiest to order. Let me give you the clean, simple routine I want you to remember. First, choose a reliable automatic upper arm monitor with the correct cuff size. Second, measure at the same times each day, often morning and evening if your doctor agrees. Third, avoid caffeine, smoking, exercise, and meals right beforehand whenever possible. Fourth, empty your bladder. Fifth, sit quietly for 5 minutes. Sixth, keep your back supported, feet flat, legs uncrossed, and arm resting at heart level. Seventh, put the cuff on bare skin. Eighth, stay silent. Ninth, take 2 readings 1 minute apart. 10th, record them, because memory is not strong enough to replace a written log. And please, if you are caring for a spouse, a parent, a sibling, or a friend between 70 and 85, don't assume they know all of this. Many don't. Some cannot read the tiny instruction manual. Some have arthritis that makes the cuff hard to place. Some are rushing because they need to get dressed. Some are frightened by every high number and too ashamed to admit it. Sometimes the most loving thing you can do is sit with them once and help build a correct routine, because one calm, careful habit can prevent a lot of fear. I also want to say something that matters deeply. Home monitoring is useful, but it is not a license to diagnose yourself in isolation. It is not permission to double your pills because a morning number scared you. It is not a reason to stop treatment because you got one pretty reading and felt victorious. Blood pressure treatment works best when your home numbers and your doctor's judgment work together. The goal is not to become obsessed with the monitor. The goal is to gather accurate information so you can make wise decisions, not emotional ones. If you have been getting odd readings, don't throw the machine away in frustration just yet. Walk back through the routine. Ask yourself, did I rush? Did I talk? Did I have coffee? Did I use the bathroom? Was my arm supported? Was the cuff on bare skin? Was I sitting correctly? Was the cuff the right size? Did I take more than one reading? Did I check at the same time as usual? Often the answer is hiding in one of those details, and once you fix it, the mystery begins to fade. And if you ever feel symptoms that worry you, symptoms like chest pain, severe headache, new weakness, confusion, trouble speaking, or sudden shortness of breath, do not sit there bargaining with the monitor. Do not keep retesting for 20 minutes hoping the number will make sense. If the symptoms are real and serious, seek emergency care. A home monitor is a tool, not a guardian angel. It helps, but it cannot replace judgment, urgency, or medical attention when danger is unfolding, and that distinction can save a life. I think about a man named Howard, 85, from Tennessee, because his story captures this whole conversation. Howard had been measuring his blood pressure for years. He did almost everything wrong, not because he didn't care, but because no one had corrected his method. He checked right after coming in from the yard. He used a cuff that was too small. He often wore a thick flannel shirt. He loved his morning coffee. He crossed his legs. He took one reading and treated it like prophecy. His notebook looked impressive, but the information inside it was a mess. When we rebuilt his routine from the ground up, the truth was astonishing. His blood pressure was not wildly out of control. It was not perfect either, but it was nothing like the chaos his old readings suggested. Some of his medication side effects made more sense. His anxiety eased. His daughter stopped bracing herself for alarming phone calls. Howard told me something I will never forget. He said, "Doctor, I thought the monitor was telling me my future. I didn't realize it was mostly describing my mistakes." That sentence is the reason I wanted to make this video. Take care of yourself, take your numbers seriously, but take them correctly, and I'll see you in the next video.